Schizophrenia is a neurological mental health disorder characterized by deficits in thought process, perception, and emotional responsiveness. Typical symptoms that you may see, and this is not one size fits all, but you may see somebody that's experiencing what we term auditory hallucinations, so hearing things that other people don't hear. Clinical term visual hallucinations, seeing things that other people don't see. The person may also have issues with communication, disorganized speech, or the opposite of that is you can see somebody with lack of emotional expression. I think sometimes people have the idea that schizophrenia is not a treatable mental health disorder, and it absolutely is. There's also a perception that people with schizophrenia are violent, and quite often what you see is very opposite. There's a paranoia and a fear of people in the outside world. So those things certainly contribute to people holding back from seeking treatment. But again, the important factor here is it is highly treatable. So if you think or suspect that your family member, friend, loved one is showing signs or symptoms of schizophrenia, it's important to get them to a mental health provider as soon as possible. We find that with schizophrenia, the earliest interventions, the better. It prevents the risk of relapse and acute inpatient hospitalizations. There are evidence-based treatments that are effective for the treatment of schizophrenia. It's like any other physical ailment, requires you to remain in treatment, to alter lifestyle, but people with schizophrenia can lead very fulfilling lives. We find that working with patients that have schizophrenia that they are really good at art therapy, they're really good at expressions with music, finding what works for that person. Ultimately reducing stress though is key because stress can definitely be a trigger for relapse. The Tallahassee Memorial Behavioral Health Center and the Apalachee Center are both great resources for people who are maybe needing an initial mental health evaluation on an outpatient basis or who are in acute crisis and may need an inpatient hospitalizations. It's great to work in a community where you have two organizations that have partnered together for the provision of mental health care because essentially there is no wrong door for a patient to be at.